cattle battle.
Welcome back, and you've got it tuned into the Ranch It Up radio show. It's the most information packed into a 30-minute program that you can find. It's your all things ranching newscast, and so glad to be hanging out with y'all. Questions, comments, concerns, criticisms, rants, it doesn't matter. Give us a call or send us a little text message. That number is 707-RANCH-20, 707-726-2420. Our email, ranchitupshow@gmail.com. Prowling around social media at Ranch It Up Show. Foot and mouth disease. Should we be concerned? The answer is absolutely. Why? Because all of us in the cow business, we are buying and selling a lot, with the prices being what they are. Either we're trying to put together grass calves, or we're purchasing breeding bulls, and there's lots of different groups of cattle being moved around this time of year. Now, granted, we have not had a case of foot and mouth disease in the United States for many years, pert near 100 years. Look at what happened at Germany. January 10th of this year, just 60 days ago, they had their first confirmed case in nearly 40 years. And yes, the outbreak is considered under control. And yes, it did lead to concerns with trade relations. Now, what would happen if it was found here in the United States with all of our technology, all of our programs, everything that is being implemented for traceability, research, you name it? What could happen here in this country? Now, this one today is all about improving our health records on our operations. Let's start with gaining a better understanding of foot and mouth disease and its potential impact. For this, we bring in Dr. Julia Herman, a beef cattle specialist and veterinarian for the National Cattlemen's Beef Association. Hey, Dr. Herman, it's good to have you back on the program. We'll get into the health records here in just a minute, but let's first start by visiting about foot and mouth disease.
So foot and mouth disease is a virus that is very contagious, most contagious viral disease in the world for two-toed animals. So our cattle, sheep, goats, pigs, and some of our wildlife species. We don't have it in the U.S. right now. The last time we had it was 1929. We really don't want it. It is a trade-limiting disease. So any of our trading partners, if we happen to get this disease, they don't want our products. Our livestock are on wheels all the time all across the country. Something like that could easily spread it if we don't catch it in time.
You said 1929, so almost 100 years ago was the last time that we had any trace of foot and mouth disease in the United States. So why is it still on the watch list? Are we being watchdogs about it if it's been pretty near 100 years since we even had to mess with it?
We recognize the economic significance. So we already talked about it being a world or a trade limiting disease. We live in a global economy. So we have people flying in and out of different countries. Foot and mouth disease is found in 2/3 of the countries in the world. And so people are visiting there on vacation. They're visiting there for business. And they may not understand the impacts that could happen if they happen to bring, dirty shoes back from one of these countries. And so I think it's not necessarily that we're all of a sudden worried about it. It's just a constant something in the back of our head that we're like, we just need to be vigilant and make sure that our biosecurity measures are up to speed. Foot and mouth disease spreads just like BBD, honestly. So it can be spread in aerosol. So it's sort of like a respiratory disease, but at least in that way. It can be spread in the feces. It can be spread animal to animal. So the daily biosecurity things that we are doing to protect our animals, so from respiratory diseases like BBD, all of those will apply to foot and mouth disease if it happens to come in. But there's going to be some enhanced biosecurity steps that we're going to have to step up to make sure that we protect our animals from getting exposed to foot and mouth disease.
So what can we look for? What are some symptoms of foot and mouth disease? And we don't want to get somebody scared where, oh my gosh, I got foot and mouth disease or something like that. But what is something to watch for where something isn't right?
Sure. So foot and mouth disease is one of our vesicular diseases. And so it causes blisters in the mouth, on the teats, on the feet. And so animals, they'll be sick. They won't be as productive. But what happens is a lot of your adults will get sick all at the same time. The challenge with some of these vesicular diseases, especially in our livestock species like cattle, they mirror a lot of other diseases that we already see. So we talked about BBD. So BBD in its very severe form can actually cause blisters like this. toxins. If your animals get into toxins, you can cause blisters in your mouth. So there are a lot of things that look like a vesicular disease, but that's why it's really important for producers to have a really good relationship with their veterinarian. If you see something odd, we really need to have that veterinarian come out, check it out, make sure it doesn't need to be tested. The best way that we're going to be able to offset the impacts of foot and mouth disease is, one, diagnosing it early, but two, containing it as quickly as possible. And that means understanding what enhanced biosecurity steps, so like within the secure beef supply plan, what steps that producers need to take to make sure they're protecting their animals from potentially being infected. And then that also is a contingency plan to make these producers be able to still continue business during an outbreak.
You know, when we're right smack dab in the middle of bull sale season, and some people going across county lines, across state lines to get different genetics, I've noticed that a lot of producers, as they're making their introduction of bull sales or in their sale book or whatever that they have, they're really starting to emphasize a lot of their management, but specifically around healthcare. That they're describing, this is what we're doing, this is why we're doing it. I think that's great from a perspective of something that is those outside genetics that is complementary to ours, because too many times it's really easy where, oh gosh, we see that set of open heifers running through the sale barn and wait a minute, can I make money on these? And it's a last minute split second decision a lot of times to bring them in. But I notice that more and more people are stepping up. Even selling the commercial cattle, people are giving a complete list of this is what I'm doing. And those types of things not only are good preventative measures, but they also help to market those calves. Value add of just doing something that we should do.
Absolutely. I think that's a really great lesson that a lot of producers can take. And it's biosecurity and how we take care of that animal. I mean, biosecurity steps overlap a lot with our herd health steps. Just like you said, we improve the health of our animals, we improve their welfare, we improve their productivity. It really is a domino effect. And so when you are getting animals from other producers who have those same values as you do, from testing the animals for contagious diseases. So maybe it is BVD, maybe it's Johne's, maybe it's anaplasmosis. When you bring those animals onto your herd, you want to make sure they're as healthy as possible, but you also don't want to get your home herd sick. So BQA walks through quarantining animals. So if you're make sure you separate your new animals from your home herd. You're protecting your home herd, but you're also protecting your new animals.
And not just the pen that is right beside them. That's get them a ways away a little bit.
Right. Separate feed, separate water, ideally separate fence line. Having that 3 weeks of quarantine for the producer to pay attention to that animal, make sure they don't come up with any diseases or, respiratory disease or anything like that. Have a veterinarian come in and check them if something does happen. But you really want to make sure you're bringing in healthy animals to your home herd. That's a huge investment that you're putting into that bull or maybe your replacement heifers. You want to make sure that they are going to provide you, long-term productivity, and they need to start off on the right foot.
When we buy a new vehicle or we're vehicle shopping, this is me anyways, when somebody says, I have record of all the oil changes, of all the repairs, has something like that, a complete record of that vehicle, less likely that we think, well, we're going to get a lemon. Now, some of us will pull the trigger anyway, and it's a good buy, and we're willing to take that chance. And sometimes it works, and sometimes it doesn't. Sometimes you get the best deal of your life. You bought this car for $2,000, and it gets 35 miles to the gallon, and everybody's happy. You could do that the next time, and it could literally break down, and you're out a pile of money, right? It seems to me that as a lot of us producers, we would be so much better off of taking just a tiny bit of time to really put together the same thing like we would for a vehicle, to make something more attractive for selling our product. I'm talking, selling a pile of feeder steers or selling bred heifers. So in a practical application, what is the best way to do that? And I'm maybe talking shoot side or something like that. If we're PGing our heifers or whenever we're running them through it, would you recommend trying to keep a little bit of history on each one? Is it record body condition score? Is it, feet and legs that we come up with our own type of, how would be the best way in your opinion and I know you do a lot of education, but bringing this all the way down to us being vigilant, as you said, of actually turning this into an opportunity to, one, be vigilant, but number two, to capitalize on a premium from just doing what we're supposed to do. So what would you recommend doing to be able to establish that track record, if you will, that service record on our calves or bred heifers or whatever we're selling?
Honestly, I think it starts with beef quality assurance and getting certified. A lot of that record keeping, herd health planning, all those basic things that the producers are doing to make sure these animals are as healthy as possible. We're already doing that within the BQA program. And so when producers get certified, they're committing to the animal care standards that are in that program. And I think it gives a lot of ideas on what producers can do. It really depends on the goal of the operation. I mean, if you have a stocker operation, your goals are going to be different than if you're a seed stock operation. Working with your veterinarian and understanding what metrics are going to be good, I think that's super helpful. For me, I'm a data person anyway, so I like to put.
I'm a data guy too. I love going through the numbers.
Yeah, so having that body condition score is a really easy one for producers to do on their own. Pay attention to records, vaccines, treatments. That plays into our withdrawal times. So all of those basics really can pan out in the end. It really depends on the goal, and it depends on the risk that the producer's willing to take. Everyone has a different risk, but we can adapt our herd health programs. We can adapt our biosecurity programs to that specific operation to make sure we're protecting those animals and helping them be as healthy as possible.
And bottom line is develop. I say this and say it, and I preach and preach and preach, but really develop that relationship with your veterinarian. They don't just want to see you at 3:30 in the morning out at your place doing a C-section. That's not what they want to do, even though they'll do it. That's part of their practice. That's not what they want to do. They want to be a consultant. They want to be part of your operation and make decisions together.
Yes. Veterinarians are trained to prevent diseases. And so that prevention starts with consulting, understanding what your herd does, understanding how your animals move through the entire cattle industry system. How do we set them up for that next stage of life as good as we can? But yeah, we really want to prevent diseases, and we want you, the producer, to be as productive as possible. And so that comes on a more routine basis than an emergency.
Dr. Julia Herman, thanks so much for the time. I know we really danced with several topics, but this is where we bring it full circle, and that is about having that relationship with your veterinarians, because if your outfit is like ours, we're looking to add cattle, fill pastures, trying to get bargains, of course. We're all trying to do that, cattle in, cattle out. So we need to have a defined program and stick to that program. So if some type of disease should ever enter into the herd, we know how to deal with it. And it is inevitable that our cattle are going to get sick at some point. That's just the nature of the beast. Okay, it is time for a breather and a break on this one. The Ranch It Up Radio Show will be right back. Keep it parked, y'all.